Hi, my name is Anna and I'm the National Lead Neurointerventional Radiographer for Scotland. I have been asked to talk to you about becoming a radiographer and what it's like to be a radiographer. So I went to Wexford College about 25 years ago and I did my GCSEs and my A-levels there. At A-level you need two or three A-levels, one of which has to be a science if you'd like to apply for diagnostic radiography as a degree at university. The degree course itself is 4 years long and is split between academic work within the university and clinical work out in a hospital or a community centre. The clinical work that you will do, you'll shadow a radiographer and work alongside them, learning how to do chest x-rays, knee x-rays, trauma x-rays, anything at all that requires some kind of imaging. You'll also learn how to communicate both with the other members of staff and the patients. Patient communication is absolutely key in this job. After your 4 years, when you qualify, generally newly qualified radiographers work in larger hospitals to gain experience in anything and will work alongside the other radiographers. Every day is completely different. You could be doing GP x-rays one day and you could be working in an operating theatre or a trauma centre doing a big resus case the next day. It really is a fascinating job. As you get a little bit more experience under your belt, the degree progression is a great route to go down. You can extend your career and extend your skills and capabilities. A lot of radiographers give injections, a lot of radiographers can now report on x-rays and scans. Some radiographers work within A&E departments, triaging patients, examining patients, doing their x-ray, diagnosing, treating them before sending them home again. It's a great job to have. Throughout my career, I've also was lucky enough to become one of the first forensic radiographers, and I was qualified to work for body identification, setting up of a temporary mortuary in a mass disaster situation. Thankfully, I've never used those skills, but they were certainly good ones to have, certainly interesting. I've also managed to travel quite well with my career, and actually it's one of the more well-known careers to take around the world with you. I went to Australia and worked for 9 months in the largest trauma centre in the Southern Hemisphere, which was absolutely fascinating work and certainly tied in quite well with a little bit of a holiday out there as well. When I came back from Australia, I worked in the major trauma centre here in Edinburgh and then have progressed to specialise in neurosurgery, which is what I do now. Is I work alongside a team to fix people's brains when they've had particular types of brain hemorrhage. The progression through radiography can lead you right up to consultant radiography if that's where you want to go, or you can just specialise within smaller hospitals. There really is so many different routes that you can take through radiography. Obviously, in the current climate, radiography has been quite at the forefront with the COVID-19 pandemic. Everybody that's been admitted to hospital across the world really has had chest x-rays and chest CT scans. These have been primarily used to diagnose and track disease progression throughout their inpatient stay, and really has been at the forefront of managing the COVID-19 pandemic. Radiography as a career is a really good career. These days I see my own patients, I see them in clinic and I speak to them on the phone. I'm part of the diagnosis progress and I'm part of their treatment progress as well. We see them in the recovery phase, I see them on the ward. It's not always just about taking the pictures, pressing the buttons. There's so much more to this degree, and communication really is one of the biggest key things.